The Union Minister of Health and Family Welfare, Dr. Mansukh Mandavia, today virtually inaugurated and laid the foundation stone for several healthcare projects in Meghalaya, including the foundation stone of the critical care block at Williamnagar and Khaliariat. The Minister of Health and Family Welfare, Government of Meghalaya, Dr. M. Ampreen Lingdaw, inaugurated the Integrated Public Health Laboratory under PM Abhim at Pasteur Institute in Shillong. Under the PM Abhim financial year 2021 to 26, the Health Minister also dedicated the identified locations of critical care block and integrated public health laboratory to be built in 7 districts of the state of Meghalaya. Speaking to press persons, Dr. Lingdaw expressed gratitude to the central government for assisting Meghalaya in strengthening its healthcare centers.
So you see, the Government of India has been very generous in assisting the government of Meghalaya to strengthen its health facility centers. And in the last few months, we were given a total of 7 projects by the Government of India, and these include projects of the critical care blocks. We have 2 critical care blocks, one in Williamnagar, which is a 50-bedded hospital, district hospital, and the other one was in Khaliariat, which is another 50-bedded hospital where we're going to be building the critical care block. So these 2 important interventions will go a long way in strengthening these 2 district hospitals, which are the secondary care centers for citizens of the state of Meghalaya in these 2 districts. We are also very, very happy that the Government of India has given us infrastructure building in 5 IPHLs, the Institute of, these are testing centers. Testing centers in the state of Meghalaya, which include one here in Pastures Institute, one in Jowai, one in Maukarwat, one in Mendipathar, and one in Ampati. Now these labs, these Indian public health labs that have been modeled by the Government of India will attempt to improve testing facilities for citizens, both for the communicable as well as the non-communicable diseases, if I have my fact right. So what happens is that citizens spend a lot of money, out-of-pocket money, at the time of testing for investigation of certain diseases. Now these labs, 5 labs across the state of Meghalaya, will substantially reduce the out-of-pocket costs for investments in these testing facilities. You must have seen we now have state-of-the-art technology, and they are able now to test and to be also surveilling. The surveillance nature of these labs is that they will be able to predict if there is an outbreak of certain diseases. So this is very, very important for us. We've seen cholera outbreaks, we've seen diarrhea outbreaks, we've seen outbreaks like the COVID outbreak. Now an institute of this nature, with the necessary manpower, who are already specialists in their own fields, will be able for us to preempt, to address before an outbreak, and to attend to the extent of damage that such diseases can cause to the population of the state of Meghalaya. Very, very grateful to the Honorable Health Minister who has himself attended the program, and very, very grateful that the Honorable Prime Minister has been forthcoming in his assistance not just to the state of Meghalaya but to the entire northeastern region. We also saw today that there was the inauguration of the National Pharmaceutical Educational and Research Centers. Guwahati now has one. Now again, this takes India on a different plane. And it is very interesting to be watching the works that can be done, the research that can be undertaken, and the kind of specialized education in the field of health and health allied services. So this is where you see that the Indian health system requires not just an investment for bringing out more doctors into the system, but we also need the paramedical experts. You see, the microbiologists, the chemical biologists, all of these now will be able to place India at a very positive step from a worldview. So this is something which is happening, and we must thank the Honorable Prime Minister for his vision and for his constant guidance. The Honorable Health Minister of the Union Government, who has always, at every point of time, remembered the state of Meghalaya.